And especially when it comes to stress, what we're talking about there is, those socioeconomic factors that you may or may not have control over, connecting you to resources to manage them, and then your mental health.
Hmm.
I think that's such a neglected part of physical health is actually mental health. And we can't expect that you're going to feel better physically if we're not also addressing what's going on for you mentally. So that's sort of like my general approach to anyone, eating disorder concern or not. And then from there, we'll do a thorough medical assessment and intervene where we need to intervene. But
Right.
it has to start with that sort of baseline evaluation of knowing where we're starting from, not making any assumptions about what's going on based on any medical conditions you have or what you look like or your weight or whatever, where we start with asking the questions, hearing from you what's going on, what your goals are, and then we go from there.
I love this because, to be perfectly honest, you haven't even mentioned anything medical, right? Like, and so it's like how relieving to be like, if every person got this kind of care, which ultimately is time and curiosity, if everyone got that kind of care, then I feel like the health system as a whole would be so much better. Like, you're bringing in social determinants of health, you're bringing in mental health, and really enhancing on how those areas affect our physical health. And so, yeah, it is. I love this. Y'all, we're talking to a doctor here, and you haven't mentioned anything medical. It's amazing, right? We're talking about how to assess health, and you're just giving people time and opportunity to share more about themselves. So, yeah, I mean, this is kind of a systemic issue where doctors need ultimately time. And so that's where it is kind of a bigger systemic issue for finances and insurance, and who knows who has time to actually do these assessments. But if time is available, then how cool to just really get to learn about your patients a little bit more. Um, I love that. Can I come to you?